Welcome to Simple Life. Today we will discuss about the dangers of eating pork. Do you really want to risk your life for a piece of pork? Every year, thousands of people die from eating pork that is infected with Trichinella spiralis, a parasitic roundworm. Pork is the most common source of this infection, which can cause fever, muscle pain, nausea, and vomiting. In severe cases, it can lead to death. So please stop eating pork and protect yourself and your loved ones from this deadly parasite. Pork can also contain harmful toxins that can make you very sick. So, if you're looking for a healthy and safe protein source, skip the pork and choose something else instead. The trichinosis parasite found in pork can cause a serious infection that leads to death in some cases. Pork is also high in cholesterol and saturated fat, which can lead to heart disease and other health problems. So why eat something that could potentially make you sick or even kill you? There are plenty of other, healthier foods to choose from. Eating pork can be dangerous to your health. A pig is a scavenger and will eat anything, including dirt, feces, and dead animals. This means that the meat of a pig may contain harmful bacteria such as E. coli and Salmonella. Pork has also been linked to heart disease, diabetes, and cancer. Despite these risks, many people continue to eat pork. Some argue that cooking pork properly will kill any harmful bacteria. However, even if the meat is cooked correctly, there is still a risk of contamination from utensils or other foods that have come into contact with the pork. If you are looking for a healthy alternative to pork, consider eating chicken or fish instead. Here are 5 news article warnings why you should stop eating pork. Number 5. Quit eating pork. It's hard to imagine anything more stomach-turning than discovering tapeworm eggs in your brain, but that's exactly what happened to a young girl in China after she ate contaminated pork. According to a recent Newsweek article, the child was rushed to the hospital after experiencing seizures and other neurological problems. Doctors did an MRI and found more than 100 tapeworm eggs inside her brain. Fortunately, doctors were able to treat the little girl and she is now recovering well. But her case serves as a sobering reminder of just how dangerous foodborne illnesses can be. Every year, millions of people get sick from eating contaminated food, and some cases are even fatal. Number 4. Sky News. Eating pork can have some serious consequences. An unidentified 18-year-old from India went to the emergency hospital after having major convulsions as a result of parasites spreading to his brain. His parents informed the medical professionals in Faridabad, India, that he had been dealing with right groin pain for a week. According to a case study in the New England Journal of Medicine, he was confused and had swelling over his right eye. He also had a tender right testicle. His brain had white blotches all over it, according to an MRI of his head. Each white spot was actually a cyst brought on by the larvae of the pig-specific tapeworm. In the patient's eye and testis, doctors also discovered cysts. His cerebral cortex, the outer mantle of the brain, as well as the brainstem, were damaged by the cysts. The individual was identified as having neurocysticercosis, a unique type of cysticercosis that affects the brain and is brought on by the immature form of the tapeworm. He was given steroids and antibiotics by doctors, but he passed away 2 weeks later. Number 3. Times of India. After she ate contaminated pork, doctors discovered more than 100 tapeworm eggs in the child's brain. Excruciating migraines until a CT scan revealed her brain was infested with more than 100 tapeworm eggs. When a particularly severe epileptic fit brought her to Artemis Hospital in Gurugram, neurologists found the eggs, the Times of India reported. They likely entered her bloodstream after she ate tapeworm-infested pork. The girl was identified by the hospital's director of neurology, Dr. Praveen Gupta, as having neurocysticercosis, a parasite condition that results in larval cysts in the brain. Pigs that consume feces that contain the parasite Taenia solium, sometimes known as the swine tapeworm, are the main source of neurocysticercosis transmission. According to parasite specialist Carl Zimmer's article for Discover magazine, the worm can lay up to 50,000 eggs in a pig's stomach that spread throughout its body. When eggs become stuck in tiny blood vessels, they produce cysts in the pig's muscles that spread to people who eat infected pork. According to the Mayo Clinic, tapeworms can live up to 30 years in the intestines of a human host and lay eggs that develop into cysts in the muscles and eyes. However, when the larvae of the pork tapeworm enter the brain's ventricles, they may disrupt the flow of cerebrospinal fluid, which may result in water on the brain or, worse, a brain hernia, which is frequently deadly. Before the larval cysts in the girl's brain hatched, doctors were able to find them and use anthelmintic drugs to kill the eggs. According to the Times of India, she had previously been given steroids before doctors discovered the tapeworms, which led to her gaining more than 40 pounds while doing nothing to stop her seizures. Number 2. USA Today. In a man's brain, doctors discovered hundreds of tapeworms. Pork is at fault. Numerous tapeworms were found in the brain of a Chinese man, 46, who was being treated for epilepsy and had consumed undercooked pork. Additional scans also revealed additional tapeworms in his chest and lungs. According to The WHO, undercooked, contaminated pork is the source of neurocysticercosis. When pigs become infected with tapeworm eggs, which are typically spread by a person's excrement who has tapeworms, it can spread to humans when swallowed, resulting in tapeworm eggs festering in the brain. According to The WHO, if left untreated, they can remain there for 2 to 3 years after hatching. Number 1. MSN News. After doctors discover tapeworm eggs in the brain from eating pork, the teen has seizures and passes away. An 18-year-old Indian man arrived at the hospital's emergency room complaining of a sudden, severe discomfort in his groin. The young man, who had previously experienced convulsions, arrived at the hospital swollen over his eye and in a bewildered and confused state. His situation was covered in a recent New England Journal of Medicine investigation. Antiparasitic medications could not be provided to the patient in India because medical professionals believed they might exacerbate the inflammation and swelling in his brain and result in his loss of vision. Instead, he received steroids and anti-seizure medication to treat the inflammation. A week later, he passed away. It's important to remember that eating pork can come with risks. The Centers for Disease Control and Prevention, CDC, warns that pork is one of the most common sources of foodborne illness in the United States, due to the fact that it can be contaminated with a variety of harmful bacteria, including Salmonella and E. coli. So why take the risk? There are plenty of other delicious foods out there that don't come with these dangers. What do you think about this video? Do let us know down in the comments section below. If you enjoyed this video and want to hear from us, again be sure to hit that subscribe button before you go. Thank you.